Hi everyone, and welcome back to our channel. In today's video, I want us to take a look at a spice and all its amazing benefits. And I bet most of us have it in our kitchen right now. It's called cayenne pepper. Before we get started, I just want to remind you that you are responsible to do your own research. I am not a medical professional or an herbalist. I just enjoy studying herbal medicine and health and wellness on my own. I'm not against the medical field. There are plenty of wonderful doctors and nurses out there that care for us and our loved ones in our time of need. With that said, also keep in mind that herbal supplements, just because it's natural, doesn't mean that it can't be harmful or have any side effects. So always consult your doctor or herbalist if you want to start taking herbal supplements, especially if you're pregnant or nursing or before giving it to children. So, cayenne pepper has been around for centuries. It's known for its spicy heat, and that heat comes from capsaicin, which is the active compound in cayenne pepper. It's found in the membranes and seeds of chili peppers, including cayenne. According to WebMD and the FDA, they have approved topical capsaicin treatment for nerve pain, and current research on capsaicin injections to relieve arthritis pain looks promising. Capsaicin is used to help relieve neuralgia, which is shooting or burning pain in the nerves. It is also used to help relieve pain associated with rheumatoid arthritis, muscle sprains and strains, migraines, improves blood circulation, lowers blood pressure, helps diabetic neuropathy and osteoarthritis, fibromyalgia, reduces cholesterol, protects cardiac health, bolsters digestion, helps with colds and congestion. And if you put some cayenne pepper in some warm water and gargle, it'll help your sore throat. Cayenne also helps psoriasis, shingles, weight loss by suppressing your appetite and increases fat burning. It is also full of antioxidants, has vitamins A, B1, B2, B6, C, potassium, zinc, beta carotene, folate, and manganese. That is quite the list of benefits for a pepper. You can incorporate cayenne pepper into anything you want. I always add some to our scrambled eggs. I put it in my soups, my sauces, meats, fish, dips, and you can control how spicy or not you want it. But either way, at least it's getting into your system. You can buy or grow your own peppers and eat them with your salads or meals. Another way is you can buy supplements and use them as directed or under the supervision of your doctor. There is also cayenne pepper tincture that you can mix in with your juice or water. And you can make or buy a cayenne pepper salve or cream that you can apply topically to your muscles and joints. So I did read that cayenne pepper can interfere with certain medications, and this is not the full list, and that's why it's important to tell your healthcare provider all the meds and supplements that you're taking or that you want to take. The list includes blood thinners such as Coumadin, Plavix, and warfarin, aspirin, and stomach acid reducers such as Pepcid, Prilosec, Zantac, and ACE inhibitors. But can cayenne pepper really stop internal and external bleeding, pain relief, and stop a heart attack? Let's find out. First, what are the symptoms of a heart attack? Usually chest pain or tightness, left arm pain or numbness, and pain in the jaw. There are some videos out there with some medical doctors saying that cayenne pepper does stop heart attacks and others saying that it doesn't. However, the ones that said that it doesn't help stop heart attacks had many comments where people were saying that it did help stop their heart attack. So let's look at a few books and some articles I found regarding all of this. And I highly recommend every one of these books. They are filled with great life-saving information. So let's start with the articles. So this one is from the Daily Health Post. And the first one is that capsaicin helps kill cancer cells. Dr. Sanjay Srivastava, not sure if I said that right, and colleagues from the University of Pittsburgh School of Medicine treated pancreatic cells with capsaicin. They found that it disrupted the mitochondrial function and induced apoptosis, which is programmed cell death, in cancerous cells without affecting normal pancreatic cells. Our results demonstrate that capsaicin is a potent anti-cancer agent, induces apoptosis in cancer cells, and produces no significant damage to normal pancreatic cells, indicating its potential use as a chemotherapeutic agent for pancreatic cancer. In another study, researchers found that capsaicin suppressed the growth of human prostate cancer cells by 80%. Dr. Soren Lehman of the Cedars-Sinai Medical Center and the UCLA School of Medicine said that capsaicin had a profound anti-proliferative effect on human prostate cancer cells in culture. It also dramatically slowed the development of prostate tumors. A study by the University of Cincinnati found that applying capsaicin to specific skin locations in mice caused sensory nerves in the skin to trigger signals in the nervous system. These signals activate cellular pro-survival pathways in the heart, which protect the muscle. Researchers observed an 85% reduction in cardiac cell death when capsaicin was used. Keith Jones, PhD, a researcher in the Department of Pharmacology and Cell Biophysics, said topical capsaicin has no known serious adverse effects and could easily be applied in an ambulance or emergency room setting well in advance of coronary tissue death. If proven effective in humans, this therapy has the potential to reduce injury and/or death in the event of a coronary blockage, thereby reducing the extent and consequences of a heart attack. And this next part I found very interesting because in the same article they referenced Dr. John Christopher, who's a famous herbalist. And if you're not familiar with him, definitely look him up by his book in the School of Natural Healing. His biography is included in that, and he had an amazing life and overcame a lot. So in this article, it says, in addition, Dr. John Christopher points out that in 35 years of practice and working with people and teaching, I have never on a house call lost one heart attack patient. And the reason is I poured them a cup of cayenne pepper tea, which is a teaspoon of cayenne in a cup of hot water. Within minutes, they were up and around. Dr. John Christopher suggests to take the cayenne pepper tea as the heart attack patient is waiting for an ambulance to arrive. And that's important to note. You still need to go to the hospital and get checked out. You don't just drink the cayenne pepper tea and go about your business. So get yourself to a hospital and make sure you get everything checked out. The American Heart Association states the benefits of cayenne pepper as it reduces cardiovascular risk, lowering the risk of heart disease, heart attack, and strokes, has an anti-inflammatory effect, improves the blood vessel health and arterial calcification, which is plaque buildup, and is full of antioxidants. So let's check out what some of our herbal books have to say. This one is the Prescription for Nutritional Healing, and this is a great reference. All of these are great references, and some of it's going to be a little redundant, but it's good to hear it over and over. So in here it says capsaicin has been attracting attention for its ability to relieve pain in persons suffering from neuralgia. Capsaicin is not a product of chemical engineering, but a component found in plants of the same family as red peppers. Researchers in Toronto found that 56% of people with neuralgia who were treated with capsaicin cream, Zostrix, for 4 weeks experienced a significant relief of pain, and that 78% had at least some improvement in pain. Clinical studies suggest that capsaicin directly reduces the amount of substance P, a neurotransmitter responsible for the transmission of pain impulses. Capsaicin cream is sold over the counter in most drugstores, and it should not be applied until the blisters caused by shingles have completely healed, or extreme burning pain may result. Our next book is the Survival Medicine Handbook by medical doctor Joseph Alton and Amy Alton. Wonderful book. I have to read through this a few times. This has got everything you need to survive medically. So in here, and they do expound more on capsaicin. I'm just kind of highlighting, little things here. It does say a natural substance found in cayenne pepper called capsaicin may also be helpful during a myocardial infarction, which is a heart attack. Animal studies at the University of Cincinnati show an 85% decrease in cardiac cell death if cayenne pepper is used during the attack. Interesting. This next book is from Dr. John Christopher. It's called Herbal Home Health Care. And it's basically almost the same as this book, only this is more, this one is more condensed. But let's go to this section here. It says, in an emergency heart attack, a teaspoon of cayenne in a cup of hot water taken quickly has saved many people's lives. And then, let's see here. Now we're going to go to bleeding. Let's see if it stops internal and external bleeding. So, a wound, external or internal, will stop bleeding if the individual will drink a cup of water, preferably hot, with a teaspoon of cayenne pepper. The bleeding will stop generally by the time the person can count to 10 after drinking the tea. The cayenne equalizes the blood pressure from the top of the head to the feet. This keeps the pressure from the hemorrhage area so it will clot naturally, which it cannot do with heavy blood pressure pumping the blood rapidly at the hemorrhaging area. And then this one covers nosebleeds. A teaspoon of cayenne pepper in hot water taken internally will stop most nosebleeds quickly. Let's see, I already read that part. So this is not a miracle. It is the principle of the cell stimulant, cayenne, traveling through the entire bloodstream and regulating the pressure, so the pressure of the flow is the same in the feet as it is in the head or any part of the body. This takes the heavy pressure off the hemorrhaging area and allows for quick coagulation. And then we're going to go back to the survival medicine book. And they say cayenne pepper. The pepper itself is used dried and powdered, infused with oil as a tincture or mixed in with a salve or a cream. Applied directly to a wound, it may be useful to stop mild to moderate bleeding. Cayenne can be taken internally as a tincture or as a pinch of powder in a tea to treat intestinal infections, sore throat pain, or gas. It has even been used in a tea or tincture in early stages of a heart attack. And our final book, which I'm still getting through this book, it's called The Lost Book of Herbal Remedies. This is really good. So it says, cayenne is a powerful styptic. It helps blood to clot both internally and externally. For small cuts, put a thick layer of cayenne directly onto the cut. Large wounds benefit from both external administration and internal use. As soon as the wound is covered in cayenne, drink a glass of water containing 1 teaspoon of cayenne pepper. It helps the blood to clot quickly. And for those that have poor circulation, this says that cayenne is an effective herb for increasing circulation and for warming cold hands and feet. Sprinkle a powder made of equal parts of cayenne and dried ginger powder into your shoes or socks. Cayenne can be used alone, but it's often too irritating. Use only a pinch, approximately 1/8 of a teaspoon at most. And for diabetics with blood sugar control, cayenne has a significant effect on blood sugar levels and can help bring them down in diabetic patients. Take 1 capsule of cayenne pepper with each meal. The cayenne must be taken regularly to give the best effects, which increase over time. Hypoglycemic patients, which is those that have low blood sugar, should avoid the use of cayenne in foods and supplements. And then it just goes on to give, recipes on how to make, your salves, your massage oils. So I'm really enjoying this book. The major difference between medical doctors and naturopathic doctors is medical doctors are educated in how to relieve symptoms rather than how to fix the reason for the symptoms that are there. A naturopathic doctor are educated in fixing the root cause. Now, as a medical coder, I read patient reports all day long, and doctors always tell their patients to diet and exercise, stay away from drugs and alcohol and smoking for a reason, because they know that's 99% of our problems. That's where it stems from. A lot of people just assume that doctors just want to throw medications at them, and some do. But if we're not going to follow their recommendations on taking care of ourselves, your medical doctor is going to figure that out pretty quick, that you're not motivated to change. So what are you expecting your doctors to do other than treat you with prescription drugs? We need to take responsibility for what we are putting into our body. A lot of our chronic issues like diabetes type 2, hypertension, COPD, obesity can mostly be reversed just by diet and exercise alone. And I get it, it's hard. I'm not going to sit here and pretend that I'm some kind of health nut and that I don't enjoy a bowl of pasta or some donuts. But I make an effort to eat as healthy as I can, and once in a while, enjoy some pasta or some sweet treats. And the more you do it, the easier it gets, the less medications you have to take, and the healthier you become. What I noticed in both the books and the articles and other research that I did from the American Heart Association and the FDA and the university studies was they were all consistent that cayenne pepper is great for the heart and is a powerful pain reliever, metabolism booster, reduces your cholesterol, plaque buildup in your arteries, increases circulation throughout your body, and that you are less likely to develop heart disease. None of the articles mentioned that cayenne pepper will stop a heart attack or bleeding like the books did. So, with that said, as long as medical emergency services are available, always seek medical help from your doctors. In case of absolute emergencies where medical is not available, the grid goes down, whatever, at least you have a good idea of what cayenne pepper can do. It's great for preventative and emergency situations. Now, for me, if I'm in the kitchen, I'm cutting up some vegetables, I cut my finger and it's bleeding, I'll admit my first thought isn't going to be, let me throw some cayenne pepper on it. I'm going to apply direct pressure to get the bleeding to stop. If that doesn't work, then I probably will try the cayenne pepper. And if that doesn't work, off to urgent care I go. As far as a heart attack, I've never had one, thank you, Jesus, but 911 will be called. If I can't get medical services due to some catastrophic event that is happening in my area and I happen to be having a heart attack on hand or heart attack at that moment, um, I'll choke down some cayenne pepper tea and see what happens. Worst case scenario, it doesn't work and I die. What are you going to do? Although I am going to be really mad that my last drink on earth was cayenne pepper tea and not a delicious cup of coffee. But anyway, what I have noticed over the last few years is a huge shift in people that are now turning to alternative medicines because there is a lot of distrust that the American people have for the medical field. In 2020, there was a huge disruption in the supply chain. Hospitals all across the country were overloaded. There were medication shortages. And even more recently, the fires in California, it wasn't just the houses that burned to the ground, it was businesses, grocery stores, and pharmacies. The hurricanes and the horrible flooding and power outages in North Carolina, all their medications gone, or there was just a shortage of it, which created a lot of medical emergencies. There are some medications that you can't just stop cold turkey. That's why it's best to be prepared as much as you can before you find yourself in that kind of a situation. Have a backup plan. Have a go bag ready, filled with clothes and supplies and alternative meds, something that you can grab if you had to leave your house on the fly. And know how to take care of yourself until you can get help. So I hope you guys enjoyed this video and found it educational and got you motivated to take charge of your health and see where improvements can be made. Please like, share, comment, and subscribe, and thank you for watching.